Hello everyone. Today we are here to talk about symptoms in female, and we have this great topic, and we have great ladies over here who share uh, this topic from chronic disease, organ perspective, and everything that homeopath need to learn and understand. Over to you, Tikwa.
Okay. Yeah, so we're going to talk a little bit about female symptoms today. The body expresses symptoms and they're all kind of interdependent with each other. And symptoms of the language of disease, and they are produced by the vital force. And symptoms that are specific to females are very important. And people, when they come in with their ailments, might not realize that they have a problem. It's very common that if people have an idea that if the patient doesn't complain about it as part of their main complaint or any other secondary complaint, that they don't need to factor it into their case taking. That's not exactly true, because what one person thinks is normal might not technically be normal as per a homeopath's view. So it could be perfectly normal that people think that, okay, they're having their period every 35 days and that's great for them. Or they might have menopause very, very young, or they might have, started having problems with their period when they were a teenager. Various things are very important actually to a homeopath because they give us very characteristic symptoms. Okay, so Hahnemann says in his chronic diseases, disorders of the menstrual function. The menses do not appear regularly on the 28th day after their last appearance. They do not come on without other ailments or not at once, and they do not continue steadily for 3 or 4 days with a moderate quantity of healthy colored mild blood until on the 4th day it imperceptibly comes to an end without any disturbance of the general health of spirit and body. Nor are the menses continued to the 48th or 50th year, nor do they cease gradually and without any troubles. The menses are slow in setting in after the 15th year and later, or after appearing one or more times, they cease for several months and for years. The menses do not keep their regular periods. They either come several days too early, sometimes every 3 weeks, or even every fortnight. The menses flow only one day, or only a few hours, or imperceptibly small quantities. The menses flow for 5, 6, 8, or more days, but only intermittently. A little flow every 6, 12, or 24 hours, and then they cease for half or whole days before more is discharged. The menses flow too strongly for weeks or return almost daily. Okay, so he gives us some ideas here of disorders of menstrual function, that it should come approximately every 28th day without any problems. And it should flow steadily for 3 or 4 days of moderate quantity, no gushing, no just basic spotting. Healthy colored mild blood. So if there's black blood, clotted blood, etc., we would look at that as a possible aberration. And then menstruation should come to an end without any disturbance in the body or spirit. And menstruation should continue to the 48th or 50th year. And it should cease gradually without any trouble. So if this is not the case, there may be problems that need to be addressed. For example, menses with watery blood or brown clots of blood, Menses accompanied by many ailments, swoons, stitching. Swoons means like fainting. Headaches, spasms, cutting pains in the abdomen, the small of the back, needing to lie down or vomit, right? So there's a lot of different things here that we have to look at. And Hahnemann gives us an aphorism 94 that is very important.
Mhm.
Now here, we could just read this. Well, okay, we can go back to the other one later. That's fine. Okay, can you make it a little bit larger?
More?
Yeah, make it a little larger for me. Okay, so while inquiring into the state of chronic disease, the particular circumstances of the patient with regard to his ordinary occupations, his usual mode of living and diet, his domestic situation, and so forth, must be well considered and scrutinized to ascertain that there is in them that may be tend to produce or maintain disease in order that their removal and recovery may be prompted. So he's reminding us again to look at the situation to see if there are any exciting or maintaining causes. But now we need the footnote to this.
Mhm.
That visible now?
Yes. See what he says here? In chronic diseases of females, it is especially necessary. Okay? We need to make inquiries about this. We can't just let somebody come in and say they have problem X, Y, Z and not ask them about these things because it is our job. Hahnemann says it is our job to ask about these things. So we can't just pass it by. And I realized that in some situations, when there's a male practitioner in some cultures, that this can be a delicate topic, but it's still a very important topic. And to just ask, do you have any problems with your period isn't enough because people too freely say, no, there's no problem. Unless there really, really, really is a big problem, it's really bothering them, they might not mention it. So it's important to try to ascertain whether or not to question. You need to question these things. You need to kind of go over it and go through it. Okay, so what is Hahnemann saying here? Sanjay, can you read for a minute?
In chronic disease of female, it is especially necessary to pay attention to pregnancy, sterility, sexual desire, accouchments, miscarriage, suckling, and state of menstrual discharge. With respect to a last name, more particularly, we should not neglect to ascertain if it recurred at too short interval or is delayed beyond proper time, how many days it lasts, whether its flow is continuous or interrupted, what is its general quality, how dark it is, its color, whether there is leukorrhea before its appearance or after its termination, but especially by what bodily or mental element, what sensation and pain it precede. It is sorry, precede, accompanied, or followed. If there is leukorrhea, what is its nature? What sensation attend its flow? In what quantity it is, and what are conditions and occasion under which it occurs.
Okay, excellent. This is very, very important. Hahnemann is telling us that in all females that come to us, we need to inquire. It is necessary to pay attention to pregnancy. So we need to know about people's pregnancies and how those pregnancies have progressed, and if there have been any difficulties and what types of difficulties. And then he says sterility. It means, is there a problem getting pregnant?
Mm.
So a woman that's gone for, been trying to have a baby for a long time, he would call that sterility in those terms. And sexual desire is also very, very important. If a woman does not want to have sex on a regular basis without there being any other mitigating situations, why? Because under certain circumstances, it can be perfectly normal that people won't want to have sex with their partner. For example, somebody brought to the group some years ago about how their husband didn't like them and they were living overseas. And the homeopath asked, won't she want to do that with her husband when he comes home for this visit once every 7 years, but they don't like each other? I'm like, not necessarily. She might not want to do that. So providing that the relationship is basically sound, a woman should have sexual desire, no matter what her age is. So keep that in mind as well. And then this accouchements, this is a very old-fashioned word for childbirth. So we need to look into the particularities of childbirth and see if people had a natural birth. I know that with the medicalization of birth nowadays in certain countries, for example, Brazil and India, where they generally tell people that they need to have a cesarean section for their comfort, which doesn't make any sense. That kind of, you might want to look at things like, trauma attached to that. Okay, so we need to know about birth, whether or not they had normal, healthy births and if there were any problems with giving birth. And then we have miscarriages. Miscarriage is usually labeled in materia medica as abortion, because they did not mean chemical abortion or physical abortion, with an instrument. They usually mean a miscarriage. And when a woman does have a miscarriage, which does happen to most women once, provided that they have a reasonable number of children, it does happen. It is a perfectly normal function that does not usually need to have any medical treatment, provided that it's just been very few miscarriages. So let's say a woman has 7 children and 1 miscarriage. That can be perfectly normal. But if a woman, goes to the 2nd or 3rd month over and over and over again and loses the child, we definitely need treatment there. Okay, suckling. Suckling means breastfeeding. How does the breastfeeding go? Because that is also a very important part of womanhood. Nursing your child. Okay, so, if there's insufficient milk, if there's excess milk, things like that. Okay, and the state of the menstrual discharge. And he says, with respect to this, more particularly, we should not neglect, do not neglect to find out if it reoccurs at too short an interval or is delayed beyond its proper time. And you need to know how many days somebody has their period, whether the flow is continuous or interrupted, because these give very, very important characteristics for remedy selection. What the quality of the blood is. And then he comes to this word called leukorrhea. And leukorrhea means different things to different people. But medically, as Hahnemann intends it here, he doesn't mean yeast infection. He's talking about more like discharge, because, like a yeast infection or a vaginal infection, is its own symptomology. And, it's definitely something that's a complete misery for the female that has it. Anybody out there that's female that's had a yeast infection can confirm that it is indeed one of the most miserable situations. Okay. For example, if we're looking, it's very important for the homeopath to be familiar with things like fertility, because mid-cycle there should be mucus discharge, because that accompanies ovulation, and that's perfectly normal. But we want to, as homeopathic practitioners, we need to look at the whole person in their whole life. And we do need to go into this area and inquire about things. Sanjay, anything to say here about this and how you approach this in your practice? Maybe he got up and left.
Okay. It's good to inquire for homeopath about the duration of cycles, then color, flow, Euphoria, any discharges he talks about, and talks about, right? And various types of discharge we can see can be. I have seen many such patient who actually uh, before menses or before menses start a week ago, or you can say 5 days or 6 days before menses start, everything looks like what you call it, stagnated. Body does not function likewise, or even mind also uh, does not have. And as soon as the discharge or menses starts, everything comes to normal.
Mhm.
And Licoria, it's about discharge, it's about its consistency, uh, it's about its color. We can see white, yellow, even transparent, and I have seen blue color. And I don't know what is the medical cause of that blue color liquid.
Usually a
You know,
bacterial infection,
bacterial, yeah,
often.
yeah, but not frequently the female comes in that clinic that such a blue. They might say a gray color or dusty color. Very important symptom.
So how do you breach this topic with your patients? Especially when they have 15 people with them in the room.
No problem. I will just ask about directly.
So you just direct and to the point.
Yeah.
Yeah, that's often the best way to approach it, is just directly and to the point, because if we hesitate when we need to come along these topics, then the person might feel some discomfort. If we just kind of go through it as a matter of fact kind of situation, then it's helpful. So some rubrics that relate to this, I have over here, I have a Boninghausen,
Mhm.
my old ancient falling apart Boninghausen. Okay, for example, it has menstruation. Rubric abortion, that would be miscarriage. And then we have hemorrhage, not at menstrual times. That would be bleeding between periods. Then we have uterine hemorrhage. And then we have menstruation beginning delayed in girls.
Mhm.
And then we have menstruation too early. And then we have early and scanty. Then we have gushing. Then we have late. Then we have long, lasts too long, when the period lasts too long. Profuse, when it's too heavy, when people are going through too many tampons, pads, or changing their diva cup too often. And then we have scanty, for those women who just only have a slight discharge of blood during their period, and only for a short period of time. Short is the next rubric. And then we have acrid, menses acrid. That means that during the period that there is pain that irritates the vaginal area, which is also very important, but we have to differentiate between menstrual fluid that is irritating to the vaginal area and another common problem known as the chemicals in the menstrual period products.
Mm.
Very important thing, because some women, a lot of women, when you go to the supermarket and you pick up a packet of pads, they are bleached, they are refined, they have numerous chemicals in them, and a lot of women will react to these. So we can't use Menses acrid because repertory like this was made during the time when people used natural substances only when they had their period. So this is an important differentiation. We can't use Menses acrid when there is vaginal irritation during the period, because we have to see if it's due to the products, because those Kotex pads can be very, very irritating. So you have to really look into that and say, maybe try switching to a cotton washcloth, or maybe go out and get a diva cup for next time. Do they have menstrual cups in India yet, Sanjay?
Don't know.
Hmm?
I don't know.
You don't know?
Yeah.
Because menstrual cups are wonderful, just wonderful, provided people don't have a latex allergy. They're just like this little device that you insert inside the vagina, and it collects all the blood, and then you just take it out and dump it out, wash it real good, and put it back in. It's a wonderful thing. You should try to find out if they have them there, and if they do, maybe you should stock them in your clinic.
I don't know. Actually, when in this area, many females from village still using the cotton cloth. And in cities, we see that all that sanitary napkins and pads.
Yes. So how do you advise women take care of their cotton cloths?
And I don't know much about, because I don't have such patient. But in clinical examination, I just ask them a question. It's necessary.
Because it is an important topic.
Yeah.
Do women in India usually disinfect their cloths after they've used them? And do they wash them in hot water, put them out in the sun to dry?
Maybe, yeah. But I'm not sure, because it's difficult for male doctor to. But in books, mentioned that it should be washed and to the clean. So it's
Because these are really important topics for women to understand and to know about. And to me,
because
this
we
is
should,
part of basic care.
yeah, if they had some Indian woman this session, she might tell more detail about. I can't. I'm not sure.
Well, I think that we should try to find out whether or not you have menstrual cups there. And I think that you should buy them and I think you should stock them. I think that would be a really good move, to promote good hygiene. And then women wouldn't have the embarrassment of having to wash their menstrual rags and having to find a place to dry them and stuff like that. Because isn't that a problem where you live?
Lot of women have this licoria issue and hygiene issue. But at first instance, they don't come to home. What we have patients about chronic disease, they come for other reason. They don't actually come for this.
That may be. But what does Hahnemann say in Aphorism 94?
It's important to
And
inquire in each and every case.
yeah, right. So it doesn't matter that the woman didn't come to you for that. What matters is that you make these inquiries about things like their
Yeah,
period.
we inquire about this thing. And and one more thing, I had a patient a couple of months ago, and she came for piles, and after this treatment, she was feeling better, and after some days, she was starting coming. There is a itching in vagina, and we thought what could be origin. Then she went for gynecologist, had investigation, everything, and nothing revealed. No discharge or no any disease state. And finally, when I inquire about everything, the, that teaching was actually related with the rectal hemorrhoids. Because anatomically, if you look at, it's a very thin partition between both. Just rectum is behind and vagina is forward. But if she has that varicosity of rectal veins on the anterior wall of rectum,
Mhm.
that time she might complain itching. We see that itching in the rectal region or itching in the anal region. And this lady was complaining itching in vagina. And she was thinking that there is something else, a new disease related to genitals. But finally, it was just itching from her hemorrhoids.
Hmm.
And same was, I have given here her Nakswamika. Nakswamika and end the case with nitramurine. because the piles begin with that pressure symptom during pregnancy. I just means wanted to share this case in the session. In knowing or unknowingly, we had this chronic case whose all relation was towards the female issue. She was thinking, but nothing. Unless and until we inquire about the symptom, you will not get anything. And the patient thought things about her complaints. She might not know what it's about, and homeopath has to provoke each and every symptom, each and every symptom relation between them. That's how all concomitant symptoms also have much importance.
100%. 100%. Yes, very, very
But-
important. And that is a
And
good
this
example.
this case was very nice case. Nobody actually was. Everybody was prescribing her that well, they give allopath gives such what fungal infection tablets, creams, huh?
Yeah.
And but actually those medication was also having effect on her body. I just stop everything and just focus on only that uh, rectal part, hemorrhoids. And she was always coming, why you are not inquiring or why you are not focusing this on this gynec issue. She was thinking that because I am homeopath, I don't know or I am just ignoring that gynecological issues. So between treatments, she visited a gynecologist and had an opinion. But they find nothing. But they, even though they find nothing, they prescribed medication. This is really bad. That's all.
Oh, good. Thank you for sharing that. Yeah, so vaginal itching can be related to various things. There are various circumstances that can cause it. And
Okay.
you see here that said in the chronic diseases.
Can
Can
I
you pull it
share
up?
that screen
Yeah,
PDF file?
yes.
Which one?
I don't know. I don't know which one I sent them to you in what order.
One is this. There is this one.
Okay. Uh-huh. Yeah, so here's different things that are indicative of needing antisporic treatment when the menses only flow for one day or only a few hours or just a little bit in small quantities, or when it flows for 5, 6, 8 or more days, but only intermittently. So these are symptoms of, are these latent spora or spora? Oh, another thing, when it comes to things like vaginal itching, sometimes a woman has pinworms.
What?
exactly.
Yes, sometimes there are pinworms
Where?
that leave the rectum and then like lay eggs near the vulva, and that can cause itching.
No.
Yeah,
Oh, damn.
right. Especially, you see this in little girls that are scratching themselves and scratching themselves. Sometimes they just simply have worms.
Oh no. Okay.
Yeah, so that's an important thing to know as a practitioner too. Yep, little girls that have itchy crotches oftentimes have worms and nothing else. But this can happen with grown women too. Okay, so there's different things here, like stitching headaches, blood that smells bad. So we have to look at things like I said, when we're using things like for things from the drugstore, the pads and the tampons and stuff like that with the chemicals, they can cause so much irritation that this is also something to rule out. And this is not obviously not addressed by Hahnemann because back in those days, women used to take their rags and they would boil them after they had each period, and then they would set them out to dry. And then that way they didn't irritate like modern day menstrual products can. And that's why I'm suggesting to Sanjay or everybody else out there in India to find out if menstrual cups are available, because menstrual cups are wonderful and most women enjoy them very, very much. And this is something that you can stock and charge whatever, or even give them away for free. I mean, I would say that's so worth it because, that can really clinch the deal with you being the family homeopath if you can provide a menstrual cup for the females.
Mm.
And now there's a new modern development called period panties. I have no experience with period panties because those are fairly new, but I know my niece uses them, and they seem to like those a lot. But I'm sure you don't have those in India.
Mhm.
But do you have period panties there in Croatia?
I think I've seen them advertised, but I'm not sure whether they're I think they are on the market in like we have a lot of German drugstores and I think they probably carry those, yeah, but a lot of menstrual cups, many of which are popular with my friends, but personally not a fan yet.
Yeah, but a lot of women really do well with them,
Oh no,
and it
definitely.
and it sure beats. If you live in a rural village, there's stigma first of all with having your period.
Mm.
And then, not only are you having your period, but then you have these rags that you have to deal with, and you might not be able to just throw them away. You might need to reuse them because there's a limited amount of different things that,
Oh no, for sure, for sure.
right. So people need to know how to care for these things. And something like a homeopath just giving away menstrual cups can just be such a help because you just say, put this in hot water or boil this for a couple of minutes.
No,
You know,
definitely.
really help a lot of problems that women have, just with the logistics of having their period. I mean, if you live in a place that doesn't have any bathroom facilities and you have to use the field and you have to have your period, I mean, just think about how complicated that is.
No, you're definitely right. It's a very fine idea because the
Yeah.
cups are so simple, really easily washable, and very eco-friendly and budget-friendly. You just buy one and you can use it for, I think, at least 2 years.
Yeah,
So it's a
long
great
time.
idea. Yeah.
Right. And then you just need Sante. Then you just need just a little bit of fabric just as a backup. And I mean, assisting people with hygiene is part of Aphorism 4, how to stay
Yes,
healthy.
definitely.
Mhm.
And I think
Yeah.
it like I mean with women and women's rights, especially women in third world countries, just I don't think it's only helpful in terms of hygiene, but I think it's really being an ally and giving support to them in a lot of ways, just showing care for their
Mhm.
well-being in general. So it's a really wonderful idea, yeah. For any kind of practitioner to bring up these topics in general and to be like, it's okay, you know, to talk about these things.
Yeah, it's just part of everyday life, you know?
No, for sure. But I know that, I mean, you know, where I'm from, it's not talked about often. And, you know, even mentioning these kinds of things, which are not, you know, it's not even sexual, it's more like a body, you know, body kind of thing. Just like, I feel like talking about it, you know, in front of male friends can be uncomfortable, and I don't think it should be. And I know I've spoken to clients, for example, from Australia, where they said, like in their culture, like having menses is considered like quite, which is a first world country, mind you. And this client told me like just having a menses is considered quite dirty in a way, and they're often put on birth control, young girls from a young age, for no particular reason, but just like kind of to control the menses more.
Hmm,
Yeah.
fascinating.
Yeah, that's what I've been told with just one person. So maybe it's not a good
Mhm.
sample, but you know, I mean, definitely we have a problem with that in general. So again, very progressive of Hahnemann to talk about it 200 years ago as something that should, you know, matter in a case.
Yeah, it really gives us really, really important information case-wise, and then also removing cause-wise. You know, we're really fulfilling aphorism 4 when we look into various things like menstrual hygiene.
Yep.
Okay,
And I
Sanjay.
mean, vaginal health in general, I'd say. So not just during that time of the month, but
Oh, yes, for sure, 100%. I totally agree with you. And this is something that I talk about regularly with people who come to see me for treatment. We talk about all these different things
that's great.
because it's important.
It is. What do we have here?
Yeah, we're going back to the chronic diseases about the disorders of menstrual function. Menses do not appear regularly on the 28th day after their last appearance. So, in Hahnemann's opinion, 28 days is the ideal cycle. And that means from the beginning of the period until the beginning of the next period.
Mm-hmm.
So, that in Hahnemann's terms is ideal. And that the period should come on without other ailments. And it should continue steadily for 3 or 4 days with a moderate quantity. That means a quantity you can cope with,
Mm-hmm.
not gushing and not too scanty. And it should be healthy colored, mild blood. It shouldn't smell or anything like that, but it is going to smell a little bit like blood, obviously. And then on the 4th day, it should imperceptibly come to an end
Mm-hmm.
without any distress of the body or the spirit. And these are our goals as homeopaths, to make women's periods this good.
Mm.
And then we come here to menopause. He says that the menses should continue to the 48th or 50th year, cease gradually without any troubles. Now, how often do we see women who have no troubles with menopause? Sanjay, how often do you see women without any problems with menopause?
I think most every woman has some or any symptoms here. Probably that might be due to that full contraceptive use.
What do you mean?
OCPs that pills to regulate cycles.
Oh, like hormonal replacement therapy?
Yeah.
Are you talking about hormonal replacement therapy or are you talking about contraceptive pills, Sanjay?
Contraceptive pills.
Okay.
So you think that women have menopause symptoms because of the use of contraceptive pills?
Actually, lot of women have those during those was to think to lengthen the cycle time if like that. Occasionally they use, and due to which uh, there are much irregularities in the cycle, and probably due to these hormonal irregularities they might face some issues during
So should women not have hot flashes or vaginal dryness?
that's natural effect, but should not trouble. It should not disturb her routine.
Hmm.
Because Hahnemann is saying here that women should have their period up till their 48th or 50th year, and then it should just go away without any troubles. He's not saying that hot flashes are normal. He's not saying that vaginal dryness is normal. He's not saying that sex should hurt. Because they shouldn't. So menopause should really just come and just be a very simple thing, just like how we want women to have very, problem-free periods. We want there to be a problem-free menopause as well. And those are our goals as homeopaths.
Hmm.
Now menopause happens earlier in India, right?
Yeah, 40, 45,
Oh,
early 40s.
that's
Maximum will have in 40s.
that's quite
Very
early.
rare, very rarely after 50.
But why is that? That's quite early.
There was a question for you, Sanjay. You're going to ask your question.
Yeah, sorry, I
Oh,
don't know
I
if
don't
you
know.
heard
I
me.
don't have answer. Even books they have mentioned menopausal age from vary from 35 to 42 or 45
I think it'd be just
like
nearly
that.
catastrophic if a woman had menopause at 35. That just sounds terrible.
Sounds devastating, yeah.
Right. Because I mean, when are you going to have your children, right?
Yeah.
Mm-hmm. Okay. So these are Hahnemann's goals that we want the period and the menopause to come and go without any big disturbance. Of course, there's always going to be just a little disturbance because literally when you are having your period, there is just disturbance. You can't wear white pants. There's just various things that are disturbing, but it doesn't have to you say that our goal as homeopaths is to make sure that this comes and goes without there being much in the way of problem. And that is our goal as homeopaths. So those are some of the things that Hahnemann tells us, and we have to remember that we must inquire even when the main complaint is not centered upon the menstruation or the inability to get pregnant or the difficulties with getting pregnant or this, that, or the other. I'll go back to touch on another thing. Sometimes when women go off the pill, sometimes you need to give them a remedy in order to get ovulation to start up again. That does happen, and that is manageable with the homeopath. So yeah, I mean, you know, we take care of people of all stages of life and all different types of everything. And that's part of the fun of what we do. We don't have that subspecialty. Well, some homeopaths do. Some are reproductive specialists and stuff like that. But a lot of us just, you know, see people from cradle to grave, right? And female function is part of everyday care. Anybody
Yep.
have anything else to say?
Mm, not really, but I agree about the part how people are often not aware of having other issues along their chief complaint. And I've admittedly not had many clients, but the ones I did have, they did tell me that homeopathy was enlightening, and you know, the totality of, let's say, holistic approach, and just making them become more aware of their body and the issues they were having, you know, and helping all of them, not just their chief complaint. So I think,
Absolutely.
yeah, I think female problems are quite important, and I can understand as both a practitioner and, you know, a patient why Hahnemann would, you know, put them on a pedestal so much, because I think they tell a lot about women's health and well-being in general. So very important to work on that.
100%.
Yeah. And it's a very noble goal to, you know, really, if it's possible, to make women's menses and menopause is really that carefree. I think that's absolutely amazing. Yep.
Sanjay, want to sum this up for us and finish it off, the topic?
I think we are almost done.
Yeah, that's what I say. You finish off the topic for us and say goodbye to the people.
Can continue take over.
Well, we're done here as far as I can say. If anybody has questions, they can leave it in the comments. And if anybody who is watching, you know, that is members of our groups, they can definitely come to the group and ask various questions about how to approach this. But this is important. Yep, well, thank you very much for joining us. And hopefully there's been good food for thought. And hopefully you've had some encouragement to breach these topics with your patient. And if you enjoyed this video and this learning topic, you know, reach out to us. Thank you.